Welcome to our 3-Minute Therapy podcast on YouTube and on Podbean. And I'm Dr. Michael Edelstein. I'm a clinical psychologist who does ReBT, Rational Emotive Behavior Therapy. And I've written 4 books. One of them is 3-Minute Therapy. And I'm here with my colleague, Kevin Benbow. Kevin, do you want to say a few words about yourself?
Yeah, my name's Kevin Benbow. I'm located in Yuma, Arizona, and I see people completely virtually, either by two-way video conferencing or by phone. If you reside in Arizona, I probably take your insurance.
Okay, very good. Thank you, Kevin. So why don't we explain what ReBT is for the newcomers? And ReBT, because ReBT is the focus of our podcasts and YouTubes. And ReBT stands for Rational Emotive Behavior Therapy. It's a type of therapy that was developed by Albert Ellis beginning in 1955 and has radically changed the psychotherapy movement from a more traditional approach to a more modern, active, directive, present-oriented approach. Albert Ellis has written over 80 books, has some YouTube talks if you're interested, and that's ELLIS. And both Kevin and I are longtime practitioners of rational emotive behavior therapy. Today, we're going to be discussing errors therapists make, which are not hard to find. And we're talking about ReBT, Rational Emotive Behavior Therapists. So let me start with a couple, and then Kevin will add, and then I'll add a few more, and then I could go on until we run out of time. And one of the main errors therapists make is that they don't do the work that would help them be a better therapist and understand ReBT more deeply. And that is to practice the rational emotive behavior therapy yourself. And one of the main ways to do it is to write out the 3-minute exercises. Some people call it the ABCs, where you write out at A, B, and C, you diagnose your problem and the irrational beliefs that are causing it. And at D, E, and F, you question, challenge the irrational beliefs and come up with a saner perspective. So the more you practice that on yourself, the better you'll get, because the more experience you'll have, and you don't even require someone else to be talking to. And not only will that make you a better therapist, but it'll make you a saner person, because the more you practice, the more you get over your depression and anxiety and addiction causing beliefs, and the more you create a better life for yourself. So that's my first admonition. Practice yourself, which it's my understanding most therapists don't do. And I write out 2 3-minute exercises every day, 2 ABCs every day. And I've been doing that for years. And that's why I'm such a good therapist. And that's why I'm so sane and rational. Did you want to mention one, Kevin? And then I'll come up with some more.
I just want to dovetail off of what you said there, Michael. I think really I see myself as I practice ReBT on myself, and then I spend my days reinforcing it to myself when I talk to clients about their issues. So I feel kind of fortunate that I can practice that. One mistake that I believe is very common among therapists, because a lot of us were trained in programs that emphasize more of a person-centered approach, is a lot of us have a hard time interrupting clients when they're talking. We're taught to be really good at active listening, to reflect, that sort of thing. but it's important to keep the session directed and focused on a problem, where we can meander and go all around a lot of different things and never really get anything done. And so I think it is important for us to interrupt tactfully, but it is important for us to interrupt when needed.
Yes, yes, I think that's very good. And that reminds me, when I was a beginning therapist, I felt like I sort of had a lion by the tail because the client was running around with one topic, jumping from one topic to the other. And I was largely just listening, asking a question here and there. So it's important to interrupt, get control of the session. And one of the things you would do when you interrupt is bring the client back to the main subject and not go off on the merry-go-round with them.
Mhm.
Um, Another principle I'd like to mention is not, or another error, is not starting with the basic principle. So it's important to start with the basic principle, which is that your emotions and your behaviors come from your thinking, your beliefs, your ideas in your head. So whenever a client discusses a problem, bring it back to this basic principle. What are the ideas in your head? What are your irrational beliefs, demands, must, shoulds, and supposed tos that are causing the problem? That's where you would start in order to do something about it. So emphasize that basic principle. And it's always good to ask yourself, if you get lost in a session, in terms of the A, B, and C, activating event, irrational belief, undesirable emotional consequence, if you get lost, where am I in this roadmap of the ABC? Am I with the client's A or B or C? And if you're at this C, irrational, rather undesirable emotions, bring them back to A and B. So you want to anchor it in B, in the irrational belief. So that's a very important discipline to use when you work with clients.
Mhm. I tend to structure my own conversations with clients like that as well. In fact, I'll write the ABC on the notepad that I have in front of me in the session so I can keep track of things. I notoriously don't trust my own memory. Another mistake that I believe a lot of us have made, I know I sure have, is we mistake a client feeling better for getting better. We can have a quote good session with a client, and everybody leaves the session feeling better. But the big question is, has any cognitive change occurred? Have they changed, and have we challenged their beliefs sufficiently? Have we noticed? Have we noticed a change in emotion when we go from a person having a more rigid must or should to having more of a preference? One thing I do to look for this on a regular basis is when I get to the E part of the 3-minute exercise, is I'll ask the client to read it aloud. This is the modified belief, the revised should or must, and I ask them to monitor themselves for a change in their affective state or their emotions at that point. And it's most of the time, I would say 9.5 times out of 10, they'll come back and say, I feel the emotion getting lighter. And that's a good segue to talk about healthy versus unhealthy negative emotions.
Yes, I like that idea about feeling better versus getting better. When I was 18 and had all kinds of emotional problems, depression, anxiety, procrastination, you name it, I went to the psychoanalytically oriented therapist. He was a wonderful guy, very warm, and the sessions consisted largely of uh, his uh, his asking me, um, "How do you feel about that?" And that's interesting, and I understand what you're going through. And I felt very good after the session. Here I was, an 18-year-old with lots of problems, felt misunderstood, very self critical, and he was just the opposite. But after the session, feeling very good, I had no tools to work on the problems that I had. And all I could do was look forward to the next session and feeling good, but not getting better. So that is a big mistake. A lot of therapists focus on warmth, empathy, compassion, helping the client feel better. And often that brings them back for another session because it's sort of like a drug. Immediate pleasure, but long-term displeasure because they still have the problems. I wanted to mention a concept that I discuss in my book, 3 Minute Therapy, called the problem separation technique, which I think is very important to untangle the client's problems. And the problem separation technique says, as we go through life and as we go through the day, we have various challenges that we'd like to meet. And those are practical problems. But then, being imperfect humans, we often escalate them into emotional problems. So I have a practical problem. How do I get up in time in the morning in order not to be late for work? That's a practical problem. But then, if I make myself anxious about oversleeping, guilty about yesterday when I overslept, depressed about having this problem, then that's the emotional problem. So once you help the client separate that, the reason to do that is with the emotional problems, anxiety, depression, anger, addictions, you use emotional problem solving strategies such as REBT and the ABCs, 3 minute exercises. And with practical problem solving strategies, you use practical solutions such as getting an alarm clock or having a wake up service, getting to bed early. So unless you decide what's the practical problem, what's the emotional problem, and you try to use one strategy, emotional problem solving, with a practical problem, or practical problem solving strategy with the emotional problem, you'll tend to be less effective. So emphasize the problem separation technique. And this also shows the client how they can work on their own problems by separating the two and then focusing on one. And one of the goals of REBT is teaching clients how to be their own therapist. So any strategy you use, it's often useful to explain to the client, like explaining them the problem separation technique.
I think another one that happens quite a bit is we as therapists might sometimes not be challenging enough. This is actually one that I kind of see on a continuum. We can we can be too challenging or in your or in the client's face, or we can be too laid back and not challenge their irrational beliefs enough. There's a sweet spot that I think we establish as we get to know each client, and it's important for us. Even we can tactfully challenge wrong assumptions that clients bring with them to therapy about self-esteem, for example, or feeling the need to excavate their childhood and resolve psychodynamic conflicts and things of that nature. It's important for us to challenge those from the onset, or we're going to end up with probably a disconnect between our 2 points of view.
Okay, and another error that therapists tend to make is once they help the client identify their thinking, they think, okay, that's my job. Now they know why they have this problem. But insight is not enough. Just helping them see why they have their problem, the irrational beliefs, the demands, the musts and shoulds, don't leave it at that. The next step is show them how to get over it. So I think it was Bruno Bettelheim that wrote a book called Insight is Not Enough. And I think that's a very important thing for therapists to keep in mind. Just see insight normally is not going to help someone in the long run.
Dovetailing off of that, not checking homework is another thing that we as therapists sometimes don't do as well as we could. It's important if we don't if we collaborate with a client, we establish a particular homework assignment. If we don't check on it, we're communicating the notion that the homework is not important, and they'll get that idea as well. So I do my best to right toward the beginning of the session, unless there's some sort of crisis or something going on, is to ask about past things we've talked about and how it's gone. And I find that the more consistent I am about that, the more homework compliance I get, and that seems to do better for them in the long run.
Yes, and as you're saying, Kevin, collaboratively coming up with homework assignments leads to the best results rather than dictating them.
Mm-hmm. Mm-hmm.
Another thing that is very useful in therapy is to use humor. So humor gets points across in a memorable way sometimes. So, for example, if a client is upset about something that, say, rejection, then humor might be exaggeration. I agree with you. It's awful, terrible, and horrible. No person interviewing you will ever be interested in hiring you, or no man or woman will ever be interested in liking you, and it would be the end of the world. Awful, terrible, and horrible. And probably on YouTube they'll be making announcements about what a horrible person you are. So exaggeration like that could be useful as humor.
I love using humor with my clients if they're to the point where they have flexible enough thinking to be humorous about themselves. Most people do. Another thing right along those lines is, and this may or may not be controversial, but is the use of profanity. Quite often, I encourage clients, if they're okay with profanity, to throw in a couple of curse words here and there with their effective new belief to drive the point home. There's been research on how the use of profanity actually indicates a stronger therapeutic bond between the therapist and the client. Not advocating for being a regular potty mouth in the session, but it can certainly can be helpful.
Yes, yes, and that's a good point that I could use myself, and use more passionate language like fuck and shit, things like that once in a
Mhm.
while.
Right, works really well. I work with a lot of active duty and retired military, and they glom onto that pretty quickly.
Yes, yes. Another mistake that therapists make is that when they're helping a client find an irrational belief, they often think that the client has to discover it themselves in order for it to be meaningful. So rather than suggesting, well, maybe it's this or maybe it's that, they they ask, well, what do you think it is, and does that make sense, and things like that. But if you think about it, when you teach other subjects, you normally don't use discovery learning. If you teach algebra or French, you don't try to get the student to discover the right French translation or the right mathematical solution. But as the teacher and the expert, you teach those. And it's the same with this. You're the expert in irrational beliefs. And if you have some experience, you can often intuit what the irrational belief is. So you could suggest possible irrational beliefs that the client has based on how they're feeling and the situation. And some therapists were reluctant because they thought that because they're the authority, whatever they say, the client's going to agree with, and it's not going to be very helpful because it's often not the accurate irrational belief. But I found with clients that when I suggest irrational beliefs, they'll seem to act freely and saying, no, that's not it. That's not it. Oh, yeah, that rings a bell. And even some of the most timid clients I've had seem to be up to saying, yes, that works, or that really doesn't seem meaningful for me.
I so agree with that. What will happen with I generally look for the shoulds or a should or a must first in there, and then I will kind of do a comparison. Or are you thinking it's awful or that you can't stand it? And quite often, one of those will resonate more, and you can see it in their face when it resonates with them because you'll see, yeah, that's it. But like you, Michael, I've never had anybody just rubber stamp all of my suggestions because I'm such a powerful, influential therapist over here. That's
Right.
part of having a good collaborative relationship, that they feel comfortable enough to say, "No, Kevin, I think you're missing it there." Then we can throw out more examples, and maybe the place for Socratic dialogue is to ask them to say more about the situation to help us find some of the beliefs. At least that's how I tend to use it.
Yeah. Yes. Another one that I notice not only in therapy, but any kind of discussion where you're trying to get a point across is you'll explain something to someone, they'll nod or say yes, and you'll say, and you might say, and it would be a good idea to say, do you see what I'm saying? Do you understand my point? And usually they'll say yes. I understand your point. They may be confused or not sure, but it's easy to say, yes, I
Mhm.
understand it. And you think the person you're speaking to will like it, that you understood it. But I suggest a follow up. Do you see what I'm saying? The client says yes. What am I saying? To see if they really do understand it. And then they could give you their interpretation of what you said. And then you can give them some feedback on making their interpretation more accurate. So, do you see what I'm saying? What am I saying?
And I use a variant of that to make. Sometimes it's good. It's a good device to check to see if they're actually paying attention. I'll ask, "So, what goes through your mind when you hear me say that?" And right away, you can tell if they've truly understood or not. And it gives me a chance to clarify. And I find that once they've been in a session or two with me, they know I'm going to ask that question at some point. And so it tends to keep them a little more engaged because they know he's going to ask what went through my mind, and I don't want him to catch me sleeping. So,
Yeah, yeah, good point. Exactly. Another suggestion for therapists is to, in order to explain concepts, use anecdotes, stories, those kinds of things. So some of the ones I use are Albert Ellis himself, when he first devised this approach to therapy and changed the whole course of psychotherapy. He got a lot of disapproval. People, psychologists especially, didn't agree with it. It was so radical. And I spoke to psychologists and psychiatrists when I was going to graduate school, and some of them would say, oh, it's too intellectual, or he swears too much, or it's too simple. Um, so so anecdotes would help explain some of the concepts. And one that I think is useful is the case of Ingrid Bergman, who was a famous actress, and she was given a diagnosis of cancer in her acting career and was told that she had about 6 months to live. So rather than depressing herself, giving up, she was in the middle of making a movie. It was called Golda, about the Israeli Prime Minister at that time, Golda Meir, and she just continued making the movie and completed it, and died soon thereafter. So that shows that no matter how bad a situation is, uh, it's possible and a good idea to practice accepting it, not eating yourself up about it, and just moving on with your life or doing something about the problem. And it's easy for me to say, and it's hard to do, but that doesn't mean it's not something to work toward. Another anecdote that I explain is the case of Helen Hayes, who was a famous actress, I think in the 40s. And there's a theater on Broadway in New York named after her, the Helen Hayes Theater. And she had said that every time before the curtain goes up, she feels very nervous. So she was such a famous actress and performed to great acclaim. Why was she still anxious? And the answer is because she hadn't changed her beliefs. Her behavior was good, but it's a two-pronged approach to act better and feel better, and that is change your behavior and change your beliefs. So she was probably still thinking that I've done great performances, but what if this time I blow it? I fall on my face. That would be awful, and I'd be a total failure. So unless you change your thinking along with changing your behavior, you may still be dealing with the same problem.
Well, I think the important thing is that as therapists, we all make mistakes. I made a mistake just yesterday, leading a client through the 3-minute exercise. I went from C to E, and then I got to do some shame attacking and admit my mistake and correct myself. And so we all do it, and the important thing is we just keep on moving.
Okay, very good, very good. And thank you so much for joining me, Kevin. Thank you, Chris Rossini, for the technical work and the behind the scenes. And this is 3-Minute Therapy Podcast. We're here every week. And if you have comments, questions, or like to be a guest, put that below. And if you'd like to support us, donate on Patreon and practice your ReBT on yourself and others to stay on the rational side of life.